and rotavirus. So varicella zoster virus history. So the exact origin of VZV is not necessarily known, but evidence points towards it originating from Europe. But originally it was actually believed that VZV originated from Africa due to its connections and links to HIV or herpes. But up until the 19th century, chickenpox, or ZCV, was not distinguished from smallpox until Rudolf Steiner performed an experiment in 1875 that actually proved chickenpox wasn't or isn't related necessarily to smallpox. In 1954, Thomas Weller used cell culture in order to isolate the virus from fluids of sores on patients. So those are just simple experiments that have been done in the past to figure out what exactly VCV is. So VCV virus transmission. So chickenpox, or VCV, is highly contagious, and especially to those who haven't been vaccinated against it or haven't been previously infected with it. And chickenpox is usually transmitted through direct contact of blisters, saliva, or mucus of the infected person. But chickenpox can also be transmitted through coughing and sneezing, which is why so many children get it, especially after they go to school and stuff and come in contact with other children who might be infected with it. So that's why it's important to stay home or stay away from people who are infected. How common is the varicella zoster virus? So chickenpox/VCV used to be an extremely common illness that usually affected about 4 million people annually. But ever since the vaccine for VCV was introduced in 1995, infection rates have considerably decreased to about 200,000 cases per year. So since the vaccine was introduced, there's been a decline in the incidence of varicella, about 97% actually, in all age groups. So the treatment for VCV, there isn't any specific treatment, but there are certain pharmaceutical measures /items that can be used to alleviate the symptoms. So for example, just simple antiviral medicines can be used to help pass a fever if that is a symptom you have from getting chickenpox or VCV. You can use cooling lotion, which can help reduce the itchiness or chickenpox sores and rashes, or even shingles, which is another reoccurrence of chickenpox later in life. And as it says here, the same treatment that is used to treat chickenpox can also apply to the treatment of shingles. So how to avoid catching the varicella zoster virus? So VCV can be prevented with a vaccine, and history of the VCV vaccine is the first live vaccine was created in the 1970s in Japan, and then the varicella vaccine was licensed for general use in Japan and Korea in 1988. And then later, the varicella vaccine was licensed for general use in the US in 1995 for ages 12 months or older. And also another obvious way to prevent catching varicella zoster virus is to simply stay away from those who are infected or at least suspected to be infected. And here are some patients that have shingles and chickenpox. The shingles is on the left side, and the picture of chickenpox is on the right side. And as you can see, just from those pictures, you can tell it's probably very painful to deal with. So to start off with the next infection, or virus, we have rotavirus. So the history of rotavirus is that in 1943, Jacob Light and Horace Hodes found a filterable agent in the feces of children with infectious diarrhea that also caused infectious diarrhea in cattle. So the first identified cause of rotavirus was in 1973 by Ruth Bishop and colleagues. So before the 70s, essentially, there was no real way to understand what the exact cause for infectious diarrhea was. And then after it was discovered or identified in 1973, a year later, it was given its name by Thomas Henry Fluid due to its wheel-like structure. So the transmission of rotavirus. So rotavirus is usually present in stool, aka feces, and is usually transmitted by hand and mouth contact. So the most common scenario is that someone will not wash their hands after going to the bathroom / changing diapers and then touch their mouth. So infants and children under 3 years of age are most at risk for rotavirus, and this infection for surfaces is key because rotavirus can live on surfaces for several days or even weeks. So how common is rotavirus? So rotavirus is very common considering it's the leading cause of diarrheal infections in children and toddlers. And rotavirus is usually most common in children under the age of 5, and about 95% of children in the US during the pre-vaccine era, which is before 2006 because the vaccine was introduced in 2006, experienced at least one rotavirus infection by the age of 5. And based on seasonal patterns, rotavirus seems to be the most common in winter and spring, and most people think that this might actually be due to the reopening of daycares and such, where, obviously toddlers and children usually are. So treatment of rotavirus, so essentially like chickenpox or ZCV or shingles, there isn't any specific treatments that will cause rotavirus to go away, but there are certain things you can do to stay fairly comfortable while it works its way through your system. So you can do things such as hydrate, eat broth-based soup, drink fluids with electrolytes, eat bland foods such as saltines or even white toast, and avoid sugary and fatty foods because obviously sugary and fatty foods will cause it to, it will essentially become worse. So how to prevent rotavirus? So vaccinations are obviously the best way to prevent rotavirus, and there are available vaccinations for children, and Rotarix is for 6 to 24-week-old infants, and Rotatec is for 6 to 32-week-old infants. And obviously to stay clean and keep services disinfected, and always wash your hands after dealing with stool or going to the bathroom. So it's very common, logical things to do in order to prevent getting rotavirus or having someone else get rotavirus.